Hi, my name's Amber, and this is my first time using Zoom, so let's hope it works. Um, this class in general has been a struggle for me. Not not so much the that I'm doing bad. It's just the content. Um, this is the first cultural based class that I've had to take ever, and I was very excited for it and very nervous. I feel that being a nursing social work major, um, culture is important, and I didn't want to just be thrown out there into the world and not know anything about culture. So I decided to take this class, and I think from week to week, I I either get the content or I don't. I don't think there's really an in between. I either feel really confident about the things that the assignments that I'm submitting, or I don't feel so good and I just hope for the best. Um, I think that I haven't been exposed to a lot of different cultures. I grew up in a small town, and so coming to Altman is like the first time that I've been exposed to different cultures other than my own. Um, I feel like small towns you don't get a whole lot of different things. It's a whole lot of the same thing. Um, so what have I learned about myself this far? A lot. Um, I didn't know, I didn't consider myself privileged um, until this class. And I think that's a big one for me, is that I just didn't see myself as anything but me. And I think been a struggle for me just to look at myself and my life and judge it differently than I have. Um, like I said, until this class, I didn't think I was privileged, and just doing assignments for this class and watching the videos and having conversations with everybody, I've realized that I was very privileged and I still am. So I think that's been a thing that I've learned about myself. I've also learned that even if I'm not confident about an assignment, um, it doesn't mean I don't know what I'm talking about. I might not feel confident about it. And I think that's important because I'm not always going to feel confident about everything in my life, whether it's school, work, home. I'm not always going to feel 100% confident, and that's okay. Um, the thing that I feel most accomplished about is that I haven't given up about this class. No matter how uncomfortable I feel sometimes writing about certain things, I haven't given up. Like, I haven't dropped. I'm still here. And I think that's important because I'm not going to be able just to give up in my job. Um, I'm going to be a nurse, and I'm going to have patients that have different values and practices than what I'm normally used to. And I can't just say, "Oh, I'm not going to take them. I'm not going to take care of them because of those differences." So I think that's really important. Um, I think another thing I've learned about myself is just communicating with other people a lot better. Um, since this class is fully online, the only interaction I get with each and every one of you is through discussions. And I'm not gonna lie, there's sometimes that I don't know how to respond to someone's discussion post. I just kind of like write what I think is going to fit, which is terrible, but this is what I do. Um, so just trying to communicate better with everyone in this class because we don't get to have a face-to-face interaction. Because it's the first time I'm seeing probably most of you, and vice versa. And so I feel like communicating effectively through discussions and trying to get across what we mean is hard. I don't always type exactly what I think. I just kind of assume that everyone's going to think the same way I do, which is bad. So I think I need to work on just trying to get my point across through my words rather than just assume that people know what I'm talking about. What area do you feel that you need to focus on to improve? A lot. I think I could improve on, just being familiar with different cultures. I think it's going to be important in my future. I don't think it's possible to know everything about every culture. I think it's just you're going to learn it on the fly, on the job. I could study different cultures and I could never see those patients, but in the healthcare setting, we're going to come across different cultures. And whatever that culture may be, you need to know how to be respectful, and so you don't offend them or make them not want to trust you. I want to, as a nurse, I want my patients to be able to trust me, to, confide in me, to trust me, to let me take care of them. Ultimately, their life is in my hands, and as scary as that may be, I'll be trained, and I want them to feel comfortable. And if they have questions, to speak up. And, if they don't understand something, I'll explain it to them in a way that they might understand it, or at least try. The last thing I want to do as a nurse is offend somebody because I'm oblivious to their culture. I think that is just, I don't want to do it. I don't want to be that nurse that offends somebody because I just don't know. If I come across a patient and that I have and I don't know anything about their culture, I'm going to look stuff up and I'm going to do some research before I go in there, because what if I have to only talk to the male of the family? I can't talk to anybody else. Like, that's their culture. I want to do that. I don't want to offend people. What if they can't do certain medical procedures because it's not in their culture or religion? I need to know that. And there's different things, they're different values that maybe their culture is so different that they're at risk for certain health problems and diseases. And I need to know that before going in there. I don't want to walk into a room and be blindsided. I want to be prepared because I'm not good at doing things spontaneously. I like things planned out and concise. Even for this video, I have things on my phone that I wanted to say just because I'm not good at coming up with things on the fly. It's just not who I am. I feel like just improving on those, improving on effective communication. That's what I'm working on now. I'm trying to incorporate it into my clinicals, trying to effectively communicate with open-ended questions and, giving them time to tell me what is wrong. I think for me, it's bad. I tend to assume things, and I don't like it. I tend to assume, if someone has a diagnosis, I kind of think of what could have led them there? What things were they doing? And I assume things without getting to know my patients, and I need to stop. That's one of my downfalls, is that I don't want to be assuming things. I don't want to be biased. I don't, that's not what I want to do. I want to look at the facts and come up with, this is happening because of this. Not, what were they doing before they came in? Unless I'm asking them, I'm not assuming anything. This just leads down to terrible things that I don't want to happen. Other than that, I don't think this class has been bad so far. I think the most anxiety thing that I've had to do is this video, just because I can't hide behind my computer and my words. I have to actually be here. So I don't think this class has been bad. I've actually enjoyed it. I've learned a lot that I'm going to take with me in my nursing career or in my social work career, whichever path I choose to go down. I'm going to take what I've learned in this class with me, and I have liked that this class has been online because I can do it in my own time, during classes, after work. I don't have to sit in a classroom during a certain time on a certain day, and I like that it's online. I like online classes. This is a class that isn't hard to be online because it's research and it's writing and all those things that I'm not completely bad at. So yeah, overall, I like this class, and I hope that other people are enjoying this class with me because there's only like 5 of us, so it's a very small class, and I hope that in the remaining of the semester I get to learn more about different cultures, and just learning is what I'm excited about. Just learning different things and new things that I can apply to my future career.